And I think we can go ahead and start with introductions. I think probably we'll have a few more people join as we're going. I'm just going to go in the order they're on my screen. Dr. Carlbaum.
Oh, hi, David Carlbaum. I'm the pulmonary critical care physician at Harborview Medical Center in Seattle, but my role here is as the medical program director for pre-hospital care.
And if, as you introduce yourself, you have any updates that you'd like to share with the group, we'd be happy to hear them, those that are relevant to the consortium. Commissioner Brotherton.
Greg Brotherton, County Commissioner, District 3. I don't think I have any updates, but I'm sure I'll think of one when other people start talking.
All right, well, you just let us know when you find them. Kelly.
Hi, good afternoon. Kelly Parcher, Executive Director of AL 360, connected to the Pfeiffer House.
Good to have you here. Chief Black.
Brett Black, Fire Chief, East Jeff in Port Ludlow, and new dog grandfather. Trying to get the phraseology correct. Yeah, happy to be here.
Do you have an event coming up? Maybe it's a little bit later this year for the fire.
Oh yeah, do we ever? We know how to party in this. Yeah, it's our 150th anniversary of the fire service in Jefferson County on October 8th.
Well, that sounds like a good celebration. Chief McCurran.
McCurran, Quilcene Fire Rescue. As far as that, welcome to everybody. I think a lot of us have seen most everybody all for the last couple hours anyway. We've all been in a meeting since 11. It's just things been really busy. I think Chief Black can echo that one. I know that his organization's been pretty swamped and we're doing the same. I don't know what summer's going to lead towards us, but we're certainly moving forward with lots of stuff and doing lots of training stuff.
Good to have you here.
And I forgot, I work for Dr. Carlbaum.
James.
James Kennedy, prosecuting attorney and county coroner.
Dunia.
Hi, everyone. Dunia Fo, Jefferson Healthcare. I work on population health and analytics and advocacy here. Good to see all of you.
Thank you. Cherish.
Afternoon, everyone. Cherish Cronmiller, Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Clallam counties.
Thank you. Matt.
Matt Reddy. I'm one of the Jefferson Healthcare Hospital Commissioners. And I guess I'll just share a brief update. There's a attempt to do an actual public event, I believe, this weekend, Saturday, at the Blue Heron School, I believe. But they're not really promoting it a ton, I guess, because they don't want to go too crazy. But I think it's a public event. But if you have children in the district, it might be interesting. Or I guess the public can go. They're not promoting it too much. I guess they don't want a giant event. But.
Will it be focused on kids or?
Yeah, I think it's just sort of trying to be a celebration thing. And I know the hospital is doing some food, but again, I don't have a lot of details, but I don't think anyone really knows about it. I don't see a lot of promotion for it in town. So
if I show up with my plate and spoon, I'm going to say Matt sent me.
Oh, great. Well, that's the chance I'm taking, I guess.
There you go. Chief Olson.
Tom Olson, Chief of Police, Port Townsend. No updates.
All right. Joey.
Hi, everybody. Thanks for having me. Joey Rodriguez, Regional Director for Olympic Ambulance, serving Western Washington.
Good to have you here. Thanks for coming.
Thank you.
Jolene.
Hello, Jolene Crone, Deputy Administrator, Clinical Director with the Salish Behavioral Health Administrative Services Organization.
Thank you. Lindsay.
Hi, Lindsay Scalf. I coordinate the Empowered Teens Coalition in the Port Townsend School District, and we work in drug and alcohol prevention among adolescents. And I guess I have two programs that are coming up that I could tell you about. The first one is a parenting program called Guiding Good Choices that we're hosting this spring. It's a 5-session workshop, and I'll put the link for registration in the chat. And we are also hosting, in partnership with the police department, a drug take-back event on April 30th.
Oh, great. Great. And where does that happen, the drug take back?
That will be at 3 sites in the county, in Quilcene at the fire station, and in Port Hadlock at the QFC, and in Port Townsend at the QFC.
Wow, all kinds of coverage there. Thank you. Apple.
Good afternoon, everybody. I'm Apple Martin. I am the director at Jefferson County Public Health. Nice to see you all.
Thanks, Apple. Jim.
Jim Novelli, Executive Director, Discovery Behavioral Healthcare.
No updates, really?
No, actually, I had a very nice lunch and great conversation with Apple Martin today. Thank you for the
That's how you guys are together on the screen.
There you go.
We had delicious Reubens. It was quite fantastic. Thanks so much, Jim.
Okay, Anya.
Hi, Anya Callahan, and I'm working with y'all on a harm reduction communications action plan, and you'll be hearing from me a little bit later in the meeting. I'm located here in Jefferson County, and I'm a consultant and a social worker.
Thank you. Denise.
Hi, I'm Denise Banker. I am the Community Health Division Director at Jefferson County Public Health and was formerly the Empowered Teens Coalition Coordinator for the Chimacum School District. Thanks. I don't have any updates.
Okay, thank you. Gabby.
I'm Gabby Caudell. I'm the Clinical Director at Believe in Recovery and the RSAP program at the Jefferson County Jail. I do have a lot of exciting things going on. And I will share about them at a later date.
Okay, something to look forward to. David?
Hi, Dave Fortino here at the Jefferson County Jail. No new updates currently.
Thank you. Lisa?
Guess there's only one Lisa today, Lisa Ray Thomas, UW Addictions, Drug and Alcohol Institute, or ADAI, and I also work with the American Indian Health Commission of Washington State. And ADAI released the 2021 Syringe Services Program Survey Summary today. There was a webinar, it was recorded, so I can send the link to you, Lori, to share with everybody. And then we also have the 5th in the Blake series happening at the end of this month, to highlight the Recovery Navigator programs that are up and running across the state. Jolene will be one of the presenters talking about the fabulous work in Salish region.
Okay, there's a lot going on there. Leanne.
Leanne Peterson, I'm the project manager for the REAL program, which is under the Recovery Navigator program for the Salish Behavioral Health for Jefferson County. And we are excited to actually get our policy work group started next Tuesday.
I'm looking forward to that. And thank you for being here, Leanne. Brian?
Hey, I'm Brian Richardson with Dove House Recovery Cafe. Our update here is how we're responding to the COVID mandates being lifted. So as you guys know, tomorrow, the proof of vaccine mandate for restaurants will be lifted, and we will no longer be checking for proof of vaccine here at Recovery Cafe. However, we will keep the requirement to wear a mask indoors here, despite the mandate being lifted. We're going to wait till that 100 per 100,000 case rate that Dr. Berry has suggested as being safe rate of transmission before removing masks indoors. So that's what we're doing.
There's lots of good stuff going on there. Adam.
Hi, I'm Adam York, data analyst at Jefferson Healthcare. Along with the PRIMS data update, also just working on some internal projects. Nothing too exciting right now. Always exciting, but you know.
Adam and Dunya, they're the brains of the whole operation over there. I see that Richard Davies has just joined us. Richard, would you like to introduce yourself?
Hello, this is Richard Davies.
And what organization are you with?
I work with the Public Defender's Office and Drug Court.
Okay, thanks. I'm glad you could make it today. So I'm going to switch over, share my screen quickly here. But did I miss anybody? Let me make sure I got everybody. Okay. Today, we've got hopefully less on the agenda, which means we'll get through all of it. We'll go over a quick update on what's happening with the CHIP Behavioral Health Consortium governance structure. That's just changed in the last few weeks after a lot of work to get there. So we'll go over that. We'll talk a little bit about the HRSA grant application that we're in the process of putting together. And then there'll be a South County harm reduction update. And then Anya will give us an overview of harm reduction communication action plan related content. And then if we have any time left, I'll let you go early. You know, that never happens. On the CHIPS governance structure, you folks are probably all aware that the Behavioral Health Consortium falls under the Community Health Improvement Plan, and that had been and is still held together by a group of folks, or it's watched over by a group of folks. Originally, it was an ILA agreement between the city, the county, Jefferson County Public Health, and did I get all of them, Apple? Those three players. Jefferson County Public Health.
There's Jefferson Healthcare.
Yes, Jefferson Healthcare. Junior, she's probably shooting me the evil eye there somewhere. The work of CHIP is to execute the community health assessment, which happens every 3 to 5 years, and then to work with the community to develop a community health improvement plan, and then to get that approved and to execute it. Currently, we have 3 work groups that have been working on addressing what the community health assessment data showed us needed to be addressed through the lens of youth age band, working age, and older age bands. And now the combination of the Behavioral Health Consortium and all of the community health assessment and community health improvement plan development and execution, all while being housed within public health, does receive funding right now from Jefferson Healthcare and from the Foundational Public Health Services funding. And we will, CHIP as a whole will report to the Board of Health, which meets every month. So that is, and whereas before we had an oversight committee and then we went to a joint board every once in a while, I think that this evolution will allow us to have great representation from across our community at the Board of Health to give oversight to all of the work that we're doing within CHIP. And we'll also have the advantage of being right in public health and able to work with Apple Martine and Dr. Allison Berry as we discover what our priorities are from that community health assessment and go forward and do work to address them. I also wanted to show just quickly, sometimes there's some confusion about the Behavioral Health Consortium and a couple of other groups that also do mental health or behavioral health related work in the county. And those two are the Mental Health Field Response Team and the Behavioral Health Advisory Committee, which administers the 0.1% funding. And those two things do still sit and report into public health and are separate from what's happening over here at the consortium. Were there any questions on that before I go forward to the next topic? Go ahead. I'm just taking off the share screen. Go ahead, Chief Black.
Yeah, I was wondering if it's possible to find some of the resources that are shared on these meetings and maybe even the recordings so that we can kind of refresh our own memories. You know, there's so many, I just speaking for myself, but I'm sure many of us on this feel the same way. We have a lot of parallel efforts and you know, subgroups that meet, and it's good for me at least to kind of refresh my own memory from the last time we met. So if there was a repository somewhere that you could point us to, that would be helpful for me.
So I put in the chat where that is, but let me quickly show folks on the screen.
Thank you.
Let me see if I can just pull such a thing up. The Be Healthy Jefferson website. If you go to the BHC page, you'll see all of the subgroups, that are related to each program, and it has meeting slides and notes, etc. And then over here, if you wanted to look at the CHIP related work groups, each work group has updated frameworks and notes and videos of all of the meetings that have taken place to date on those fronts. And if you have a hard time finding anything, there's also, in terms of the library, all of the community health assessment documents are here and can be accessed from these links. And again, if you need any, any help finding something that you're looking for, please do reach out.
Lori, we don't see your screen if you're wanting us to be seen.
Thank you. Let's try that again. How about now? Do you see it now?
Yep.
Okay. All right. So I took you to the Be Healthy Jefferson. It can be org or com. The BHC page is where you'll see meetings or notes and meeting packages and videos related to this meeting. You'll be able to go to any of the subgroups and see the meetings and their related materials on each of those pages. The CHIP focused youth, working age, and senior groups, all of their information is on each page. And then over here under community resources, you'll see all of the information that's on the yellow card, as well as a very in-depth series of resources listed in each of these categories. And then over here at the library, you'll see grant documents, needs assessment documents, community health assessment, all of that sort of information. And yes, if you have questions, please reach out. Were there any questions on that? Okay, let me see if I can find the right screen again.
Lori, there is in one of the photos you just showed from the meeting screenshots, there's someone impersonating you. There's someone that looks just like you, but is not wearing a hat.
I know that must be a doppelganger or something.
The former Lori.
The former Lori, yeah, the pre-COVID Lori. Okay, I'm going to go ahead then and tell you a little bit about an application that we're putting together for it's the HRSA, our core behavioral health care support funding. It would go from September of this year through August of 2026. It covers $500,000 a year for a total of $2 million over the 4 years. And the lens with which we're looking at as we chase this grant is to support CHIP and the Behavioral Health Consortium's work, and specifically the youth age band objectives that were developed in response to the 2019 job, which had to do with promoting positive mental health and finding a way to eliminate youth suicide here in Jefferson County. I've been working with several of you to come up with work plan components for the grant. What we're proposing to do with the money is first provide the Jefferson County Education Partnership, which is the 4 school districts. They come together, I think it's on a quarterly basis, but basically they're working between themselves to come up with what we could do for the schools that would allow them to have funding that they had agency over, which is a different model than what we've had previously, which is to have funding that different community groups had. And then we were trying to get the schools to do something that we came up with instead of the other way around. So we're hoping this might help us address things in a more efficient manner. For the Jefferson County Education Partnership, we're looking at behavioral health services audit across all 4 districts. We want to develop and execute an action plan based on those audit results with the school, and they also are desiring to hire a school or school liaison interventionist resources. I don't know if it will be one or multiple. In working with the schools, I have asked them to make sure that among the 4 school districts, whatever this funding goes toward is agreed to by all 4 school districts. So it will help make sure that the benefit is either dispersed equally across them, or at least that they all have agreement with how the money is spent. On a second point is we're looking to address some of the unstable housing impacts in our county's behavioral health system. And of course, a big part of that is just to understand how it relates to what we do understand so far. And I think that that's going to involve collaborating with OLICAP to assess what data they have that's available, and then how to integrate the use of that data into our current data collection and analyzation efforts. And ideally, at the end, we'll be able to develop insights and use those as a foundation to develop action plans and address the any new or existing efforts to deal with unstable housing throughout the county. And then the third thing that we're talking about doing is addressing equitable access to the behavioral health supports, youth extracurricular activities and school functions. And the goal there is to create a nexus point between our rural transportation agencies and school districts, which both represent what's going on in the county and transportation sector. And to make sure that the representation of the more rural parts of our agency are represented on the transportation board. And then our last point is to expand EMS data collection by adding the EMS Council as a BHC member and having them contribute the broader range of data to the current data collection effort that we have going on. And ideally, that will improve what we're learning from the data and our coherence in how we're using it across the county. So that is a quick overview. Just quickly before I open it up for conversation, I wanted to show you that in the grant, what they are asking us to address, it was kind of a nice broad request that they were making of folks submitting applications. They want us to address the structural and systems level barriers to improve rural residents' access to the SUD and behavioral health services, to improve the quality and sustainability of the services, and then to improve the capacity of the system. I think this addressing the rural community risk factors and social determinants of health was a very broad sort of request from them in terms of what we might come up with in terms of projects. And I think with what we've outlined here that we're going to address, I think we're going to be able to click each one of those things in a way that should have them feel that we would steward the money wisely here in the county. So with that overview, I wanted to open it up and ask if there are any questions. It might be useful, I'm realizing, if you could see that screen. I'm just giving it a second so folks can. And I noticed that Kim Kustra, I hope I'm saying it correctly. Kim, would you like to introduce yourself?
Hi, I'm Kim Koistra. I'm the principal at Chimicum Junior Senior High School, and I'm really excited about this opportunity to come together to talk about some supports for our students. So thank you.
Okay, thank you for being here. I don't know when you got here. Were you here as I was sort of describing the overview of the grant and what we're looking at?
I was just able to kind of step in just now. So you got me just when I popped into the room.
Okay. And are folks able to see the screen that shows the overview of what we'll be doing? Okay.
Lori.
Go ahead.
Yeah, this is Cherish with Oli Cap. And, you know, I just wanted to say from our perspective, you know, this is important. And one of the reasons that, you know, I'm heavily focused at the agency on increasing some of our quantitative, you know, work is that it's so important when we try to get money into our communities for things like permanent supportive housing, which when we, you know, to me, when we talk about, you know, some of the struggles with substance abuse, mental health, permanent supportive housing is necessary for these populations. And, you know, permanent supportive housing isn't cheap to make or to run. But when you have good data like this, when you bring all the parties together and you've got this information at hand, you are, you know, more likely to be able to bring the funds into the community and make that argument for why it's important, and, you know, how well partners are working together and how well you're documenting, you know, these ongoing issues. You know, if some of these people were housed, right, and we provide these services in one location, you know, how would that change, you know, the costs and the time and energy being put, towards some of these issues. So I think it's really important. I know sometimes people are just like, money for another study or, to talk some more about stuff, but it really is when you try to get the financial backing from developers, from the state, tax credits, whatever you're going after, it really helps solidify the argument and provide that foundational support to bring monies into the community for that need. So I think that's, I just wanted to throw that out there, that I appreciate the work, you're putting into this to make it happen. And I hope that, we're going to see the long-term effects from it.
Thank you. And I appreciate you guys coming to the table to even think about it, because, and one of the things I have to say is what we currently have going on at the consortium in terms of our data subgroup and the analysis that's going on there. It is wonderful to write a grant with that as a base and foundation with which to add this piece now. I think it would have been much harder to do it at the outset. So to all the people that have been working on the data, thank you. And to Cherish and Kathy Morgan, who we'll be working with, and I'm sure we'll bring in the hospital and some of those data subgroup members as we start to figure out how we can best start that project. Great appreciation to everybody there. Any other questions on that topic? Chief Olson? Oh, sorry. Okay. I will then move on to the South County harm reduction. Let me share my screen. And some efforts that we're doing around a vending machine project. And I don't know if Jim Novelli, if you want to talk at all about some of the research that you've done there. I've sort of outlined what our next steps are, but maybe you could give an overview.
So here in Washington, actually, and across the country, vending machines are being utilized as Narcan distribution, facilities. I was on a call that would actually span the whole country that had the East Coast, the Midwest, and the West Coast on the distribution of these machines and how they're growing in different neighborhoods throughout the area. We were recently, I know Denise Banker and myself were on a call with, I forget her last name, Oliphant, something like that, in Seattle or King County, is ready to establish 2 machines to distribute Narcan. And here, and I know in Washington State also, Wenatchee has put a couple of machines in, as it says Moses Lake, and soon to be in the next month or so, I believe, in Omak, from whence I last worked. And I'm really excited about the idea of really getting something like that started here. And maybe in South County, we've been working with Chief Manley about setting one up in the Brennan area. I'm reached out to the MCOs here recently. I'm trying to see if they would help fund this. In fact, thank you, David, for putting that up there. I really am hoping that the MCOs, because it was Beacon that funded the machines for the North Central region, which included Wenatchee and all that. So they put the money in that. And I think our MCOs do have dollars for these kinds of projects. And I'm hoping I can maybe twist a few arms. So I've got a couple of calls. I've started with one MCO first, and then I'll go down the line and see who rise to the occasion. Obviously, there's a lot that has to happen in this project in the sense of location, hookup, who's going to monitor, who's going to stock it. But those are the fun things to work through if we can get this done. I like to start, I think the goal is to start small and maybe South County, and then move up further and put another one up at the north end. So this is still initial stages, but one way or the other, I believe we'll get it done. So.
That's excellent. Dr. Carlbaum, I think you might have already connected with a possible Narcan source. We had heard that it might be $75 a pop, and that sounded prohibitive.
Yeah, so I'm late to the party like usual, behind Jim, and just learned about this amazing human, Thea Oliphant Wells, who has lived experience and now is a social worker in King County, who is, I think, spearheading their efforts. But I reached out to Sean Hemmerly, who is overdose education and naloxone distribution consultant for the State Department of Health. He is who we get our naloxone leave behind drug from through a grant, and just said, would this be possible? And he's like, absolutely, tell me more. And what phase of the planning are you in? It does sound like we probably could get a grant similar to the naloxone leave behind and Narcan leave behind program for the vending machines. I think he needs a little more details. He actually linked me up with Ms. Oliphant Wells as an expert. So always nice to have two trails come back to the same person. So hopefully she can provide some coaching. And I asked her if she could send us budget or an information sort of background sheet like we're thinking about developing. But I think we should be able to get naloxone through the state at no charge. I don't know how much, but some.
That would be nice.
We know there are a lot of steps. Chief Manley is sort of our anchor point down there in South County, and hopefully by next month we'll come back with some more updates.
And Lori, can I ask a question? Is this a too big a group or the right size group to ask the question of what should we vend? So initially I had thought about naloxone. Anya had wisely brought up fentanyl test strips. Jim said, well, why not? I'm going to call it the Novelli Party Pack, which is fentanyl test strips, condoms, naloxone, etc., all together. And I don't know if the group has an opinion on starting small with just naloxone as a pilot and then expanding, or just going all in at once. I don't know if you wanted to ask this group or.
I think that's a great question. Anybody have any thoughts there?
I do have a thought. I think the fentanyl test strips might be not the best thing. Fentanyl has become largely the drug of choice for people, where it's not it used to be a scary thing for people to have fentanyl in their drugs, and now they're seeking it out. So that might be, not really a waste of money, but maybe. And then Sean from the State Department of Health does have great resources to get naloxone. You should be able to get it free of charge. Off the top of my head, I don't have his information right in front of me, but he is a great resource for that.
Great. Anyone else? Apple?
Sort of on a side note, but relative, my former work more directly in sexual reproductive health and my recent job, there's some movement in the state around birth control vending machines, which, when I heard that, I had to really think about that for a minute, for lots of reasons. Anyway, the package of things for safety in a vending machine is an interesting idea. I don't know how that would be perceived. I mean, it'd be perceived in different ways by different people in different areas. Sometimes you want to be able to provide as much as you can in one touch. That's what we call it. But you also don't want to overwhelm people and have them have resistance to the whole idea to begin with. So I have no answer. I think the sort of combination of birth control along with some harm reduction options is a novel idea. Mm-hmm. A Novelli idea, evidently.
A Novelli idea.
Oh, I heard it someplace else, but I don't know if it's a party pack. I don't want to use that term, but makes sense though. I mean, for safety. I mean, when I heard about putting condoms and, lube in there and all, I'm thinking, we don't think about HIV transmission that much anymore. And this is a population that's at risk for that too. So something to think about.
I see Dr. Kalbaum has noted that masks and COVID tests were also things that had come up in the context of this sort of a mechanism. Thoughts on that? Okay. Well, thanks. I'm sure that there will be more discussion. We're at the early stages of this. If you have thoughts, go ahead.
Yeah, I would say that definitely there will need to be some more probably community education. I think a lot of folks don't realize that this really is a last resort to revive someone, that people in addiction don't want to take naloxone for fun. Like it causes instantaneous withdrawal. I mean, it sucks for, somebody to go through. So I think providing that education, because I think people also get confused with methadone treatments and naloxone and what are these, if you're not in that realm, right, you don't understand that. So I think, recognizing that, yeah, that's, really a means of saving a life, and is not something that is sought after by, someone who's in addiction. I think is an important conversation to have those who, aren't knowledgeable of that realm. So
I want to go to Chief Black, but before we do that, Anya, I know that you've been thinking about what we would do in the context of community education and outreach.
Yeah, we can get into that more in a little bit or now as well, but I definitely agree with Cherish. And I think before we're like, hey, we're bringing this harm reduction naloxone machine down to have some community conversations and dialogue, and maybe conversations specifically for people who are in recovery or people who have loved ones who are using or in recovery, and then just some community conversations and like online trainings about what is naloxone, how to use naloxone, things like that. Absolutely.
Great, thank you. Chief Black?
Yeah, just to talk about how the current naloxone program works, and then looking at how that program's managed and maintained. How do you see these new options being managed and maintained? Would it be the same process?
I think that we're at the exploration stage right now. Chief Manley was going to do some exploring before our next meeting so that we could talk about maybe in more detail or more informed detail what that could look like, what it should look like.
And when Jim and I met with Ms. Oliphant Wells, she told us how they were monitoring their machines and how once they got them installed, because this is all new for them also. And they were in a lobby area, but you had to ask and you had to get a code to get the naloxone out of the machine. And so then, because they also had to report numbers too, so they had to know how much they were distributing. And then they had a small bit of a training kind of report that had to be done also. So yes, we were involved in discussing that with Tia. So.
Thank you, Denise. We understand that there's going to be sort of this technological and who owns the program question, and then there's going to be the who stocks it, down in Brennan kind of a question, and they might not be one and the same person or agency, but the goal is here to collaborate at the end of the day to get it rolling. And Brian, I just want to acknowledge that is a great idea. The Recovery Cafe is a venue for in-person education now, before we even have a vending machine or beyond. So thank you for offering that. Okay, anything further on that topic?
I just had one quick question, maybe for Denise. Did they say where the machines are in King County? I'd love to go see one as I travel on my bike through Seattle.
I actually think that they are in Pierce County. So I know that I wrote notes. It's just locating those notes again. So if I can find that, I'll let you know, Dr. Caldwell.
No rush, thanks.
I'm going to be in a meeting where Thea is present tomorrow, so I can ask her.
That's a great idea.
These machines are really decorated nicely with all sorts of kind of modern motifs and artwork and everything. So they kind of don't stand out as being like this medical machine, and they kind of fit in with, kind of graffiti look to it and all. They're kind of neat. So, and they range in lots of different prices because they can do all sorts of different things. So they're all digital, and you can access it also by a program where you get on a website and you say you need some naloxone, and it gives you a 3-digit code. You go and press the 3 digits into that machine, and it pops out your party pack, I guess, if you want to call it that. So I don't know. So
Jim, I think that's awesome. You mentioned that. What an opportunity for a local artist to be sponsored to create some art on a machine. I think art always creates more healing spaces.
I think that is a great idea. Okay, I am going to turn it over to Anya and show some slides, and she's going to talk about the communications action plan and what's going on that front.
Thank you. Hey everyone, I'm Anya, and I'm going to walk through initial assessment of harm reduction in South County. So just looking at spaces where we can grow access to naloxone and where we currently have naloxone availability. So I identified 7 pharmacies and did outreach to all of them to ask if they would honor the state standing order to distribute naloxone without a prescription. And all of the pharmacies in Jefferson County said that they have naloxone available and they're able to distribute it. So that's great. But the furthest south availability for naloxone at a pharmacy is Port Ludlow or Port Hadlock. So I'm still finding that there's no known availability or distribution points of naloxone in South County. If folks know of other things that I don't, definitely please pop in the chat or fill that in. But that was my first initial assessment, is that there's definitely a naloxone desert south of Port Hadlock. And especially as we're thinking into launching this wonderful vending machine idea, ways that we can start to do some community education around what harm reduction is and what it's not, and what naloxone is and how it can be used, and how it's really a life-saving medicine and not something that enables drug use. I think I can go to the next slide. So I'm seeing opportunities for overdose prevention and opioid safety education. I also want to promote drug testing, which I'll get into more in a couple slides. Listening to what folks were saying earlier about the fentanyl test strips, I hear that, and I did attend the State Syringe Service Program survey webinar today, which I have on the next slide as well, about the prevalence in fentanyl and a lot of opioids. But it's also popping up in a lot of drugs that it hasn't necessarily been associated with in the past, including non-opioid drugs, and finding that spaces, counties, programs that do offer access to fentanyl testing can lead people to increased awareness of other harm reduction strategies when using drugs. And then also naloxone distribution events and online training. So hosting something on a Zoom webinar, potentially partnering with the Stop Overdose and folks at UW, or some people who have hosted these trainings before. So it wouldn't necessarily be something we'd have to do from scratch. And having opportunities for people to, anonymously log on to these trainings and just witness what naloxone is, how to use it. And then distribution events. I was excited to hear Lindsay mention in her introduction the drug take back event that's happening here in Jefferson County at the end of the month. And I'm thinking of opportunities where we can tag on to some existing public health outreach events and do some education and training, as well as public coordinated communications about available services. So we do have the SCP clinic, the syringe exchange program in Port Townsend, but just getting information about what's available there and when folks can access it, as well as extended communication about hopefully these more events and trainings that we can put on in the next few months here. And then as well as the Brennan harm reduction vending machine kind of being this physical manifestation of a lot of these conversation and works that's happening. We can go to the next slide. So I'd love to hear from you all if you want to unmute or talk in the chat here about opportunities that you see for more increased outreach and access to harm reduction services and supplies, and ideas for ways that we can best reach those who are most likely to witness overdose and people who are using drugs, and what other opportunities you see.
I see that Joey has something in the chat box. Do you want to tell us a little bit about that?
Yeah, I was just wondering, are there certain concentrations of these vulnerable populations throughout the county that we're aware of? encampments and things like that. The reason I asked is we've been very successful pairing up with Kitsap Public Health, and we've actually been going out in EMS units. And typically in those encampments, they're the ones that are going to experience a lot of that, experience overdose next to them, things like that. And what we'll do is we'll mass test for COVID, and we're able to use, COVID grant to do that. But we'll also cover a lot of, concurrent needs that they also have. And then as, private sector, we'll go buy socks, tents, things like that, and kind of give them a little bit of a carrot to get everybody tuned in and really encourage them to participate. And that's where we're taking that opportunity to provide that education and stuff. And we can, we can use our resources effectively by having a sterile environment with an ambulance present, but also able to kind of cover, mass groups. And I just wasn't sure if those kind of concentrated groups are in Jefferson County as well.
We do have concentrated groups. I know that there is some Narcan distribution, but I don't think it's been done in the fashion that you're talking about. Chief Black, I'm sorry, I haven't had a chance to read. I know that you guys have been typing back and forth. Did you have any thoughts or awareness on that front?
I'm sorry, I wasn't quite clear on your question regarding Narcan distribution.
Right. It isn't something that we have currently going on with any EMS services that you're aware of. I know that we distribute, we make Narcan available, but I don't think that we've been doing it through EMS in a vulnerable site sort of.
Right now, we're only just starting the Narcan access from our 911 resources. And we don't have any of the partnerships that Joey's talking about. He and I've talked about some of these things that they're doing over there in other counties too. And I think they're great opportunities, but right now we're kind of just standing up the distribution and management of the Narcan for the first responders as we have actions of opportunities on 911 calls. That's the limit of our program as it exists today.
Well, we're excited that it is that far along. Really, there's every step is a good step in the right direction.
Yeah, for sure.
Yeah, the best way that I could describe it, not to interrupt, I'm sorry. The best way I could describe it is we've almost been treating it like down in Thurston County. We're almost treating it like a job fair. We're finding these areas, they're identified by law enforcement, mental health, agencies like OLICAP, fire department, et cetera. And when we go out there, we actually saturate them with all sorts of resources. So all the stakeholders show up. And we have a lot of one-pagers, pamphlets, and things like that. And then you just kind of pair that concurrent with some goodies. And that really seems to get a pretty engaged group. So I was just curious if that was a direction that I don't know much about the Leave Behind Narcan program. So I'll probably link up with Chief Black later and learn more.
And it's exciting to know that you've got some of those one-pagers and things. I bet we might be able to use some content that you've already pulled together as we're thinking about communications on many different levels here in this county.
Yeah, I certainly don't want to take credit for all the other stakeholders that put all that together. I'm just showing up with EMS providers in an ambulance. So
we're always happy though to see if somebody's done it well to imitate. What is it? Imitation is the best form of flattery. Trying to keep up with what's going on in the chat. Richard Davies, I thought that was a great idea. The presentation of Narcan education to drug court and behavioral health court staff, I think might be a great idea. I'll check to see if that's a possibility.
Lori, I just want to say the REAL team is distributing Narcan in vulnerable areas. We actually gave away a couple today as well behind DSHS. So we had received a box of them from the ASO and keep track of who and when we distribute them to.
Oh, great. Thank you. And Jim, is that supply? I mean, should we be thinking broader supply than just vending machine when we're thinking about supply? Or are you getting them and you're not worried about how you're funding?
No, actually, we, as of April 1st, as of January 1st, all behavioral health agencies in the state of Washington are mandated to, if anybody comes in and we believe has an opioid or we identify as an opiate issue or anything, we're supposed to help them if they wish to have Narcan available to them. So we just haven't gotten that supply yet from the state. But that's something that was put the mandate in first and supply later kind of thing. But we're working on that. So yeah, I mean, it sounds like there's Narcan available at multiple points here when I'm listening to all this conversation. I think it's just a matter of getting that supply keep going and make it as accessible and as easily accessible as possible, and trying to reduce any barriers whatsoever. So
And we've got a number of people at the open air shelter that have it,
mhm.
and then some volunteers that go out and provide it. People they know are users. I have some here in my office, so just making sure that we do have it readily available, and using those advocates who have work with relief and recovery and whatnot, and bring that in and ensure that the parties they know are using have it on hand.
And on that note, like Jim said, we are required to have it and have it accessible for people that have opiate use disorders, and we do provide it. And when you hand it out, you do have to provide some little snippet of training to the individual that you're giving it to. You can't just be like, here's some Narcan, bye.
Mhm.
And that training, I know Jolene put Sean's information in the chat. Sean's got a lot of great work, and the training's available. So Richard, I can meet with you and give you that training. And it is available, but people do have to say they want it. We can't just give it to them.
Mhm. Thank you, Gabby.
Leanne has had her hand up for a long time.
Leanne, sorry.
No, I actually spoke and forgot to take my hand down, so I'll take that down now.
And I kind of took it over from Anya as we were having a discussion. Anya, I'm handing it back to you.
Great, thank you. Well, I appreciate everyone's feedback, and it's awesome to hear so much work that's already being done in the county to increase access to naloxone. And I just want to open myself. If more things come up, I'll put my email in the chat here, and if more ideas come up, feel free to see me as a resource and continue sharing ideas. Let's go to the next slide, please. So I just wanted to highlight the State Syringe Service Program survey from the ADAI Institute that y'all did the webinar on today, and some findings from it that folks were already talking about. The really highly increased prevalence of fentanyl over the last few years, and especially in the last year. In support of more education and testing around fentanyl, I found this graph to be really convincing, that just seeing how it's like the main drug from heroin to commonly prescribed opioids that people are overdosing on now, are being poisoned on now. You can go to the next slide as well. So I had some talking points in support of testing and education around fentanyl test strips as a useful engagement tool to foster discussion with people who use drugs around practicing universal precautions, including the presence of fentanyl in their drug supply. I have a friend who overdosed recently who wasn't an opioid user. She was mostly a benzo user, but opioids are popping up fentanyl is popping up in a lot of the drug supply now. So I really think that there is a point of education and conversation around increasing this access. Test strips are easy for people who use drugs to use with minimal instruction, and the response, general response from people to use drugs about the availability has been extremely positive. Test strips are detecting positives in various drug supplies outside of opioids. People who use drugs, they cause people to use drugs become more informed about the drugs they're using, and can lead to behavioral change and adoption of increased harm reduction measures, including sharing information among peers. When people test positive for fentanyl, they're much likely to implement harm reduction strategies. So yeah, I think I only have a few minutes left, so I want to give the conversation back to you, Lori, but continue sharing ideas for increasing more services and more access to harm reduction services in our county, and conversations about what's in our drug supply and what people are being poisoned with.
Thank you so much, Anya. Are there other questions or thoughts for Anya or on this topic?
I had a quick question about the Be Healthy Jefferson website. I'm wondering how difficult it would be to have a tab that says, naloxone distribution and then list all these many different ways people can access naloxone. So if someone's like, I'm new to the community and I'm interested in some naloxone and fentanyl strips, where do I go? And it's not obvious to them. If some of those, we heard lots of different places. I wonder if that could be easily added to the website.
It is easily added, definitely. And I'm wondering if the same information might do well to be on a more accessed website. That the Be Healthy website is primarily what you saw it as. It's a big holding place for all of the related meetings and stuff. So not many public people, access it or tend to traffic there. But I'd be happy to put that information together so that it could be put on other more highly accessed websites. And then Chief Black?
Yeah, I just wanted to echo the doc's message. If we find to your point, Gloria, the best place to put it, maybe County Public Health or something else, with a nice banner or big yellow button or something, maybe we could share that link with all the people on this call. I would love to put it on East Jeff and Port Ludlow's website and Facebook pages.
That's a great idea.
Yeah, thank you. Great idea, Doc.
Other thoughts? I know we're heading in toward 4 p.m. Okay, well, thank you all. It was, we covered a lot of different things today and good discussion. I'll go back and get up a set of notes so that it can be scanned quickly. And thanks to Anya for all the work you've been doing, to Jim and David and the South County Harm Reduction Group. Lots of steps going forward. It feels like we're getting some momentum behind some things that we've been working on for more than a year now. Okay, so everybody go forth and have a great afternoon.